So here is our wound. If you look at the peri wound, this has chronic changes, telangiectasia, fibrotic changes, all consistent with a radiation injury. This patient had a history of a squamous cell carcinoma that was treated with excision and radiation. So here's the field of radiation. What we're seeing is a wound right in the center of that field, and that wound has not been healing for several months. And when you see a wound at a prior site of a cancer, you have to worry about recurrence. This wound is a little atypical. It has some margins that are a little irregular. The wound itself is a little irregular appearing. So we're going to do a tissue biopsy to confirm that this is not a recurrence. You want to pick sites that are irregular, and we're going to pick a site here and over here to biopsy. So I have my biopsy instrument. What I want to do is I want to straddle, if you will, the normal and abnormal tissue. So what we want to do is get a piece of the normal intact skin and then a piece of the wound. So right on the margin, and that is going to be perfect site selection right there. We then spin the biopsy instrument. Gentle pressure. And then we release, holding pressure. We're now going to take that biopsy core. You can see there's the core of the tissue. And what I want to do now is I want to pick that core up very gently and atraumatically. See how it pops out of the wound. And what I'm going to do is trying to be atraumatic, not to squeeze or damage the tissue. I'm going to pick it up. I'm going to come underneath and snip that core out. So we're getting a full thickness biopsy, as you see right here. You can see there's the core, there's the surface. This biopsy then gets transferred to formalin. Typically with a little hemostasis is achieved by just putting gentle pressure. You can see the biopsy site and the core where it's removed. You see it's not oozing, but a little bit. And biopsy 1 is done. I do want to re-biopsy that other site, so we're going to use the instruments again. And again, I'm going to straddle the area that I want to biopsy. The biopsy probe is rotated. Gentle pressure inward until it reaches the hub, as you can see there. And then we pull out. And once again, being very ginger and gentle with the tissue, I want to take the biopsy tissue, come underneath with scissors, snip to remove the biopsy core, as you can see there. And again, that's sent off. And you can see how we've accomplished the biopsies. Again, straddling the wound margin, 2 sites. We'll mark this is medial wound, 1 o'clock. This is lateral wound, 1 o'clock positions. You want to annotate that on the pathology report so that the pathologists know where the tissue came from, what side of the wound. That's important down the road if it turns out this biopsy is positive. And we're hopeful that it's not.